All right, here we're going to go ahead and talk about charting. Whether we're in school at a dental assistant education program or if we're on the job train, that we're very familiar that we're going to see something that looks like a tooth chart as such. Now, depending on your computer program or what your doctor is utilizing, if you're still utilizing a paper chart, your chart and tooth chart is going to look a little bit different. But I explained this is basically like our roadmap. This is our key code, that whatever is documented on your tooth chart is going to give you a representation of what is on the treatment plan when it comes to what has already been finished or what your patient needs to return back to the office to have done. So if we can eliminate going back into multiple chart notes, especially in our computer system, that we don't have to go back and read notes, that we can refer back to what this tooth chart says. So I already have some documented here. Of course, it's just a paper chart. I have my patient's right side and my patient's left. When we're learning early on as a dental assistant that how we look at something is a mirror image of ourselves. So my right and then patient's left. Of course, we start with our number 1 on the patient's right, and we're going to end on the patient's right. So our numbering system is 1 through 16 on the maxillary, which is the top, and then our mandible on the bottom. Our mandibular is 17 through 32. So you're starting and stopping on the patient's right side of the mouth. The other directional terms that we have are such as well. We have our occlusal, which is the chewing surface of our teeth. We have our buccal, which is the cheek side of the tooth. And then we have our lingual or our palatal, which is on the inside of the tooth or our tongue side. And then our mandible is the same. Our occlusal, our buccal is our cheek side, and then our lingual is our tongue side. So when our doctor is treatment planning with us as a dental assistant and we're going into our computer system, typically with a computer, we would click on our number 3 and then we would click on our mesial and our occlusal if it was a mesial and occlusal filling. Here in our education program at Cornerstone, we are still teaching paper in the regard to if you can understand it when it comes to a paper charting. Naturally, the computer system makes it even easier. As you can see here as well, I have what is called our midline. So the midline is where 8 and 9 touch and where 24 and 25 touch. So in regard to what is on our midline, our directional terms like our occlusal, our buccal, our occlusal, our lingual, we also have 2 directional terms as well. One is called our mesial and one is called our distal. Our mesial and our distal terms are in between the teeth areas where you would floss. The only 2 times your mesial surfaces touch is at the midline. So here is your mesial of number 8 and your mesial of number 9. Here is your mesial of 24 and your mesial of 25. These are the only 2 spaces in the mouth that when you floss between 8, 9, and 24, your 2 mesial surfaces touch. The other surface is our distal. Our distal is, mesial is towards the midline and distal is away from the midline. So here is the distal side of number 9. And here is the distal side of number 10. So let's go and start on the upper right side. And our doctor says number 3 needs an MO. So I have a pencil here that has 2 different colors, red and blue. Our red is indicating that something is needed. Our blue is indicating when something is already finished, or maybe your patient came to your practice or your office and already had work done at a previous appointment or a previous dentist. So you're documenting what is already existing finished elsewhere. So we're saying number 3 needs an MO. So if number 3 needs an MO, I'm going to color in my mesial surface of number 3 and my occlusal surface of number 3. So this is a cavity that, according to our treatment plan, that the doctor is saying number 3 needs an MO. Notice I did not color anything in on the buccal, and I did not color anything in on the occlusal. If it was an MOB, we would be coloring in the mesial occlusal and taking this onto the buccal side, but that's not what was documenting. As well as you can see that nothing is colored in on the distal side of number 3 because it is not an MOD. This is just an MO. So let's move forward. We're going to go with number 5. Number 5 also, or now, is a DO. So a distal occlusal. If number 5 needs a DO, then yet again, I'm going to color in my distal, and I'm going to color in the occlusal. Yet again, I'm not on this mesial side, I'm not on the facial buccal, and I'm not on the lingual side. So yet again, 5DO. When it comes to charting, let's just say number 6 needs a root canal. If number 6 needs a root canal, I'm going to put the red line through the root. And our standard of care is that our doctor is eventually going to recommend our treatment plan also a crown, that I'm then going to outline that tooth yet again in red, because in treatment it needs a crown. A lot of our computer systems will just solidly color in the red. For purposes of our book, we go with diagonal lines. That's in our modern dental assisting. And then, so I'm going to do the diagonal lines. Diagonal lines, when it comes to a book study, will determine if it's a stainless steel, a porcelain, or a porcelain fused to metal crown. Here, we are just indicating that number 6 needs an RCT, root canal therapy, and a crown. So let's move on to the upper left. I'm going to do some charting of his already finished. This is maybe a patient that's already been to your office a few times and has had treatment completed. So now I'm going to use the color blue. So my blue color is, let's just say number 14 had already an MOD. So for an MOD, I'm going to color in my mesial, occlusal, and then on to my distal. Yet again, I'm not coloring anything in on my buccal or my lingual side. I'm going to continue with number 15 and say number 15 had an MOL. So now I am going to say we did a filling on 15M, the occlusal, and then it went on to the lingual side. As we all know, that DL groove or that OL groove is a common cavity on that molar. And as well, let's just say number 16 was extracted. So we went ahead and removed that tooth. It'll either do a blue X or it'll erase it from your treatment sheet on your computer. All right, so I'm going to go on the bottom left. I'm going to say number 19 also was extracted. But I'm also going to say I want to treatment plan a bridge. So I'm going to crown 18 and I'm going to crown 20. So yet again, I'm going to do my red outline of on my 18 because I'm indicating that that tooth is going to need a crown. Again, for book purposes, I'm going to do my diagonal lines. It's indicating that it is a type of crown. And then I'm going to bracket it together, meaning I'm going to do like a football bracket at the bottom. So that is indicating that this is a bridge. Some instances, your computer will also put your tooth that is missing as part of your bridge as well. So 18, 19, 20 is treatment plan to have a bridge. Let's go into my anterior teeth. As we know, our surfaces are a little bit different when it comes to the occlusal surface, that now we just have the small incisal edge of the anterior teeth, which is the edge of when we're biting into food that is going to chew or bite off maybe our sandwich that we're eating for lunch. So I'm going to go with number 23, and 23 needs an incisal that I'm just going to go right on my incisal edge. So that is what would indicate just that incisal. And I'm going to go over to number 27. And I'm going to say my 27 needs a lingual. Yet again, this is my facial, this is my lingual. Lingual's towards the tongue. And I'm going to say number 27 needs a lingual filling done as such. Yet again, I'm not going anywhere on the mesial or the distal of that number 27. So let's go over to 29 and number 30 as well. As we know, our teeth, if we do not floss, that mesial or that distal area is where we continue to get those interproximal cavities. So number 29, I'm going to say needs a DO. So yet again, I'm going to color in that distal into that occlusal. And number 30 needs an MO. Our class 5 cavity is a common cavity on our posterior teeth. That class 5 cavity is that cavity right along the gum line. So this is number 31. I'm just going to say 31 needs a buccal. That buccal cavity here repaired. And number 32 needs a buccal as well. So those are 2 buccal fillings on 31 buccal and 32 buccal. Let's go back up to the anterior of 8 and 9 so we can talk about fillings that were maybe already done interproximally. So we're going to go, I'm going to go down here because of space on my paper. We're going to say number 8 already had a mesial facial, and number 9 has already had a mesial facial lingual. So these are fillings that were already done. So I'm going to go on my mesial surface and color into the facial area. And this would actually be an MIF because I'm on my incisal. So I'm going to add my eye here, and then my mesiofacial incisal lingual here as well. So when it comes to charting, this gives our patient, gives our doctor and us our communication tool of what was needed, what was finished, and what has already been completed. So when you're looking at your tooth chart here, you should be able to give a quick visualization of treatment that was already finished because it's in blue, but this patient still needs to return for all these other fillings and to have this bridge prepped on the lower left. So in our book terms, there's still a lot of other symbols that we can use for furcation involvement. If the tissue is bleeding, of course, we can, sometimes our computer systems will implement and draw in an implant if a tooth is missing and we're having an implant inserted in a crown. But things to remember is when it comes to tooth numbering, we're starting and stopping on the patient's right side. Our directional terms are occlusal, buccal, and our lingual. And then our mesial, which is towards the midline, and our distal that is away from the midline. Your mesial and distal terms are talking about that interproximal area of the mouth where you would be flossing your teeth. So I hope this helps with some charting. If you have any questions, if I can help explain anything more, please let me know, and watch and subscribe to our YouTube channel and our TikTok to be able to watch more educational videos that can help you in your day-to-day life as a dental assistant.